Hi, I'm Toby Kohler. I'm the chair of the Public Media Committee here at the AUA, and I'd like to summarize for you several abstracts that we just featured on lifestyle and its effect on urologic diseases. So the first abstract that we covered was one about marijuana, alcohol, ED, and depression, epidemiologic correlations with BPH and LUTs. Essentially what this study did is they looked at a very large database in Colorado, and they looked at risk factors that led to BPH LUTs and the use of medications. And for the first time in the literature, we found that marijuana use was definitively linked to BPH LUTs and the use of these medications. What we don't know is whether or not the patients taking the marijuana were using it to actually treat the BPH LUTs, or the BPH LUTs occurred as a result of taking the marijuana. But it's something that we now should ask about in history when somebody presents to us with these type of urinary complaints. The second study, which was done by Dr. Halleck, looked at marijuana consumption and the deleterious effect on sperm. And so he elegantly stratified men into different groups: fertile, non-fertile, smokers, and pure marijuana users. And then he looked at standard semen parameters and reactive oxidative species to determine what went wrong and where. And lo and behold, he found that men who smoked marijuana had much higher levels of reactive oxidative species, which we know to be harmful, and they were at levels that were akin to men who had infertility. Interestingly, men who both smoked marijuana, so both tobacco and cannabis, had even worse parameters. So very interesting data, which again shows a correlation between attempts to get pregnant and marijuana being bad in that time of trying to do that. Further research needs to be done there, though. Okay, the next study I'd like to cover is on, basically the next two are on diet. So the first one looked at the association between popular diets and serum testosterone among men in the United States. This is a study out of Northwestern. Dr. Fantas was presenting author today, and they looked at different types of diet. Mediterranean diet as one of them, a low-fat diet as another, and they looked at testosterone levels. So when they looked at the various factors, they found that testosterone levels were indeed slightly less in guys that were doing the healthier stuff, having a low-fat diet, the Mediterranean diet. The decrease in testosterone level was about 50 points, akin to about 10 years of typical aging of a man. And so I think we need to have further study as to how this is going to actually relate to the general public. I would say that a 50-point loss in testosterone isn't necessarily going to cause symptoms or affect men on average. And if you can lose weight by being on these diets and exercise, on top of that, your penis is going to get better, and erections are going to get stronger, and your testosterone is going to be better if you can actually lose weight, because weight loss has been shown to help with some testosterone. In relation to erectile function, the final study which I'd like to cover, which was presented today by Dr. Bauer, is about heart-healthy diets and erectile dysfunction. And he looked at both a Mediterranean diet and a kind of other healthy diets, and found very similar results in that both of them had a 22% decreased risk for men less than age 60 if they 22% decreased risk of erectile dysfunction if they adhere to these diets. So it makes a lot of sense that if you're taking good care of yourself, you're eating the right things, your penis will take good care of you as well. So that's a great motivator for clinicians to ask about diet, to ask about problems with erections, and discuss the intersection of this, because as we know, the first step in the new AUA guidelines for erectile dysfunction is to talk about diet, exercise, and lifestyle modification to improve function. So overall, I think a really nice set of studies today that tell us that what we do to our bodies, other than medications, is probably the most important thing we can do. And eating right and exercising and smoking habits have a profound effect on our overall health.